Well, Angela Morton joins us this morning. Morning, Angela. How are you?
Good morning.
Good to see you.
Thanks for having me.
Yeah, thanks for coming in. Well, tell us a little bit about yourself.
Hi, I work with a Rural Communities Opioid Response Program federal grant in our area.
Okay.
It's called Recovery as Community NWPA. So we're serving Venango County and the Corey area, and Crawford County also has a similar grant through the Rural Communities Opioid Response Program. So the area is like rich with funding and resources to address substance use in our area.
And you've done work all over the place, really. Crawford, you mentioned Venango, Corey, so you know the area quite well. Mm-hmm. When did you get started in this?
Well, yeah, I know the area well because I was born and raised in Crawford County. And so I left the area for a while, but when I came back and I got into mental health, I have a background in clinical psychology. So I was a therapist for many years. And when I shifted from mental health, I started doing drug and alcohol counseling and eventually got into prevention. So I transitioned from the mental health and substance use background in the clinical setting to doing community outreach and education about how to prevent and address substance use issues in the communities.
We were talking beforehand. If you look at Pennsylvania as a whole, where does this area stand in overall usage?
Well, without the numbers in front of me, the federal government, when we try to get these grants, we do needs assessment and community focus groups, and then the federal government decides where to grant that funding. And so they recognize that in rural areas like ours, substance use is rampant, and we're not just in what they were considering an opioid epidemic, it's really a crisis of death. Like people are dying from accidental overdose of opioids and other substances. So the things that happen when a person is in the throes of addiction, some of the high-risk behaviors that are also associated with addiction, put people at risk for like hepatitis C and HIV. So our area is actually high risk for outbreak of some of those infectious diseases. So they really want us to address substance use on a whole and do what we call harm reduction. So that if we can put things in place in our communities that reduce harm and put a lot of prevention education out there, then we can kind of catch the issues further upstream.
Obviously, this is something that's been talked about, and I say this in a positive way, for a long time, where I think sometimes you could look at the situation and go, well, let's not get this out there. Let's just kind of deal with it and move on. But I think folks like yourself in this area have said, you know what, we need to start talking about this. We need to have this conversation. And there's so many places to start. Where would you like to kind of begin?
Well, you and I had talked a little earlier about how sometimes people want to brush the problems under the rug, and it's not very solution focused, is it?
No.
So stigma is something that I'm really passionate about, reducing stigma associated with substance use and mental health. People need to talk more openly about suicide risk and when they're struggling with substance use or mental health issues, especially during the pandemic. All of those rates went up exponentially. So,
and just to clear that up too, it was climbing to begin with.
Yes.
And then you throw the pandemic on top of it.
And there's also, it's important to talk about, and I think you and I were talking that we could talk for hours about all of this. Like it's important to talk about. There's so many layers of it. But when we look at the pandemic and how it affected people and the isolation that so many people experienced, whether it was still using substances alone, which is very risky, or not being able to get access to the substance a person was using, and then ending up in a period of abstinence where people become what they call substance naive or not as tolerant. So when they resume use, you're at very high risk of an overdose during that time. So when people are maybe isolated at home or in a rehab or incarcerated, there's a much higher risk of overdose in the days after a person has been abstinent.
Oh, wow.
So because maybe they're going to use like a substance that they did before and accidentally overdose. So if you don't mind, it's a good segue into
Sure.
what I have in front of me.
Yes.
So pardon me, the grant projects that we work on cover 3 areas. We try to increase access to evidence-based treatment as well as recovery supports, but also prevention efforts. So there's evidence to say that when we introduce harm reduction and things that reduce substance use and reduce death, of course, like naloxone, or often known as Narcan, it's a nasal spray. Where's the turn toward the camera? So it's a nasal spray kit that is available across the Commonwealth. There's a standing order in most pharmacies throughout the state of Pennsylvania. Anybody can walk in and say, I need a Narcan kit. And it's often no questions asked. Sometimes you will need to present an insurance card, but if you don't have insurance, you also can get it. Also, every county in the state of Pennsylvania has a single county authority for substance use treatment, prevention, and recovery supports and case management. So you could go to any county office, Crawford County Drug and Alcohol, Venango County Substance Use Program, and Erie County Office of Drug and Alcohol. Anywhere in the state, go to your drug and alcohol office. You can call or you can show up and ask for Narcan, and it is free.
Wow.
So it's really very simple. I don't know how well that can, okay, got the right glare, so you can see it pretty well?
Yeah.
So it's very easy. It's a nasal spray kit that if you suspect somebody has experienced an accidental overdose, it can be used by anyone. And even if it's not an overdose and you use this, there's a lot of research, a lot of studies out there that say it is still safe. All it does is fill opioid receptors in the brain. So if somebody has used an opioid and they have stopped breathing, this will cause them, enable them to breathe again. So it's really very easy. You place it in one nostril and press the plunger firmly into the nose, and then turn a person on their side. Because sometimes it can cause a withdrawal response when those receptors are filled. So a person may wake up and be very alarmed and feel really terrible. They may be vomiting or shaking or crying. Because
Wow.
some people have described that it can feel like when you go into withdrawal, it can feel like you're dying. You're very, very sick. So we try to reduce stigma about this because, of course, anybody who experiences that is going to feel pretty terrible. And then they maybe don't want to talk about it. But if we use this and have conversations about substance use and how to get help, that it is a chronic medical condition. And even though it is not curable, it is treatable, and people do recover. So if a person's on their side and they start to breathe on their own, you make sure, first of all, when you have Narcan on hand, you call 911 and then use the Narcan. So if they breathe on their own, great, 911 is on their way. If they're still not breathing, there's a second kit in every box, so you can give in the other nostril. There's also, I won't be able to fold this back up, it's like a map. But in every kit is and I think with the lighting you can't see it very well, but it's a graphic that shows exactly what to do. There are also online trainings. Set that aside. There are also online trainings where you can go to nextdistro.org and watch a little video and request a kit to be mailed to you. The Department of Drug and Alcohol Programs also has resources if you go to DDAP, the Pennsylvania's Department of Drug and Alcohol Programs site. So there are resources out there, and they are often free. So anybody who is struggling or needs that can call their local county drug and alcohol office and get access to that.
And that's something that's new to me. I just thought your first responders were able to administer that, but you saying that you could walk in. Is the stigma there, though, that I don't want to walk in and pick that up because somebody's going to know that I'm into this? Or if somebody's kind of afraid to do that as a family member or a friend, could they go in and get that kit for somebody that they know could maybe use that?
Yes, that is often what happens. So a person can go in and get it for someone else and just have it on hand. So maybe family members, friends of somebody who's struggling with substance use would have it on hand. We also try to explain that if someone is still using substances, to not use alone. Because at least if you have somebody there with you that can call 911, the Good Samaritan laws will cover a person with some level of immunity, that even a person on probation and parole, if first responders come, the Good Samaritan law says that if you're using with someone, using substances with somebody, and you believe they're dying and you call to save their life, that you will not be held accountable.
Wow.
So yes, it's about people who are using substances having access to it, but it's also those around people who are struggling to have access. And yes, there is stigma around it, and part of why we're talking about that, and I said I'll come back anytime you want and talk about it, is the more we talk about this, And maybe the first time somebody goes and gets it and realizes there's not any shame in getting it, then they can more readily go back and get more of that. So that first time might be difficult, but we really encourage people to go and get it. And we're trying to reduce stigma and shame about substance use because it is a medical condition. Like that a person who chooses initially to engage in using a substance or becomes dependent on a prescription, for instance, that it can happen to any of us. And people who are struggling look like all of us. Like we all are people who could succumb to the disease of addiction. So we're trying to break that barrier of the profile of somebody who uses drugs or alcohol, and really break that down so that people don't have to be ashamed to show up and ask for Narcan.
When we've had conversations with folks like from the Crawford County Suicide Prevention, it's almost like that where sometimes you hear about somebody who's committed suicide, you go, I never would have thought. Never would have thought. I mean, there's professional business folks. I mean, especially as you're saying with the pandemic, there's a lot of stress in people's lives, and it's also the change in approach for it too. Like, we're not here to eliminate this. We understand that this is going to happen. Let's talk about this. Let's at least let people know, here's what you can do.
Yes, and so again, the more we talk about these things, that when someone dies by suicide, it's not often something that someone talked about. So we want to try to shed light on veterans are very high risk.
Yeah.
There are groups and populations who are higher risk than others, and age groups that are at high risk, but really anybody who's struggling and has maybe quietly been suffering with depression or thoughts of suicide can reach out and get help through I don't have the number in front of me, I should have had that, but it's the National Suicide Prevention, Suicide Lifeline. It's an 800 number, and people can call 24/7. It's national. And it's anonymous, so a person can call and talk. There's a text line, I believe, 741-741, that people can text. It's just, I knew that one easily because it's so common and it's become so well known. But yes, the more we talk about suicide risk and get people comfortable sharing or brave enough to share what they're going through, the more likely we can reach people and get the help that's needed.
Do you find that folks are willing to say, yes, I need help, or is it still one of those things where they're doing it at home by themselves?
A lot of people are still suffering silently. So there are mottos and logos out there in recovery communities. People who are in recovery will say, we do recover. So we know that treatment works and that we do prevention and recovery supports are there for people, but the treatment outcomes, when we can get people connected to treatment, the treatment outcomes are better when people have support in their recovery, which is why that's another important part of our grant projects and what we do at county drug and alcohol offices. Because if you're just going to treatment and going home and going to treatment and going home, but you don't have a recovery community or a supportive, family or friends or a network of people who understand and are there for you, you're more likely to succeed in your treatment if you have that support. So too many people are struggling silently, and we want to be able to say, if there's someone listening that's struggling, is thinking, I think I'm having some of these issues, or I think I'm at risk, that you can call your county drug and alcohol office. And every county in the Commonwealth has a drug and alcohol program. They can just start with a screening that you call and say, listen, I have questions. I heard about being able to call, and they'll screen, and it's very brief. If agreeable, then a person can say, you know what, I think I do want an assessment, and they'll do what is called a level of care assessment. And then they could be referred to a variety of providers in each area and get connected to whether it's maybe just some counseling. It could be maybe somebody needs rehab or inpatient treatment. It could be a combination of counseling and a lot of people call it MAT, medication-assisted treatment, but it's really better known as medication for opioid use disorder. Like buprenorphine or Suboxone or Subutex or methadone. And those are things that are evidence-based treatments. They're the number one most effective way to effectively treat opioid use disorder is with medication and counseling.
You're watching the Morning Drill on Stream Television and on Armstrong's Neighborhood Channel and listening to it on the Allegheny News Talk Sports Network. Angela Morton with us here this morning. Folks may recognize you from Recovery Is on Armstrong's Neighborhood Channel.
Yes.
That's been fantastic. What's that like to bring in other experts and have these conversations?
Well, I have to say, it's rewarding to be, not just like publicly talking about it, but in small groups, in large groups. This opportunity that you've provided us to get the message out there widely is wonderful. But it is really inspiring to talk with people who are experts in addiction medicine or people who are in recovery. They're probably my heroes and a lot of our heroes because they're here to tell the story. So everybody who you may know in recovery has a story, and there's often a trauma background, maybe unaddressed mental health that nobody talks about, like you were saying. So for all the heroes out there that are finding wherever your road to recovery is, day one or complete abstinence, recovery looks different for everyone. But yeah, we do a lot of important work, and I'm not saying that in a prideful way. I just am really honored to be able to talk to people every day about increasing access and awareness about substance use.
Are your guests folks you've come across in what you do, or have you done some research and said, but this sounds like somebody that would have a great story to tell?
Well, so far, thanks to Kevin and Ryan, who got Recovery Is. Thank you for plugging that. We have a series on the Armstrong Neighborhood Channel that Recovery Is really just started with, can we just have an interview like this? And it became, why don't we do a series? So we asked a doctor that we work with in addiction medicine, and we asked somebody we know in recovery, and we asked some of the nurses that work at one of our partner hospitals. And so it's really just sort of organically and naturally unfolded that we work closely with a lot of people that are also passionate about what we do, and people who've been impacted by substance use.
And not afraid to talk about it.
Yes, that's what I was about to say.
Yeah.
And being courageous about talking about it, because I don't know anybody who doesn't know someone who has struggled with mental health or substance use concerns. Like, it's close. It's not just in general in society, but in families and communities.
What would you say to somebody who says, well, is it fair that somebody struggling with this doesn't have to pay for this? Because there's still that stigma, right?
Mm-hmm.
What
And
do you
yeah,
say?
I appreciate you bringing that up, because we did talk about that sometimes they're like, well, that's a free medication. We can save lives. People are dying, and you can save a life immediately by using a nasal spray. I wish all medications we could have free and easy access to those medications. This happens to be a disease, and there is a lot of shame and guilt around the disease. And people aren't maybe as readily going to a doctor as they are when they have, diabetes or asthma or heart disease.
And that's important, because I think a lot of folks who don't have that addiction are thinking, well, just stop using it. Just like that, it's just a switch, you just turn it off. That's not the case.
It's not the case, and as I mentioned a little earlier, that the government, when they give these grants, they want to make sure that we're not just saying we need to be a strictly abstinence kind of education, that everybody's just going to quit. It's not realistic, and it's not. We need to focus more on harm reduction as well as treatment and whatever path of recovery people choose. So, addiction changes your brain. So a person who uses a substance. And the large percentage, I don't remember where the statistic fell off, it was 75 to 80% of people that were struggling with opioid use or misuse had at some point in their life had a prescription and were using it legitimately and appropriately, and maybe became dependent on it and realized when they were going off of it that they felt really terrible, and they had to find ways to make that terrible feeling go away. So nobody just wakes up one day and says, you know what, I think I'm going to just try to use drugs, just see what it's like. It's usually kind of it graduates into heavier substance use, and then it is really difficult to just stop because your brain has changed. The actual structure of your brain has changed. So those neurotransmitters are now wide open and empty and need to find a way to be filled. And people will do almost anything, and people in recovery have said to me, you just need so badly to make that feeling go away. It isn't even about using a drug or drinking to feel good. It's, I need to make that feeling go away.
I have that every morning. I think this sounds horrible, but I can't wait for that first cup of coffee this morning.
Well,
that's it. Right?
And for a lot of people, that might be the most relatable thing. I mean, tobacco is a dangerous substance. Alcohol is still the number one most dangerous substance, and people are addicted to caffeine or can't quite get woken up until
Right.
they get their morning drill.
Well, listen, let's have you back real soon and continue this conversation.
I would love that. Thanks,
Angela,
Luke.
thank you for your time.
I appreciate you
All right,
having
take
me
care.
here.